Good night, everyone. I will make a presentation about COVID-19. Before my presentation, I will introduce myself. My name is Chelsea Sabel Haurisa. What is COVID-19? Coronavirus, or commonly called COVID-19, is a contagious disease that was initially caused by cough, flu, shortness of breath, sore throat, lethargy, and fatigue. Some have problem with lung pain. This disease is very common for people who are elderly, have a range of diseases, and who have decreased immunity. This coronavirus is very dangerous because this virus causes very severe disturbance and even worse, even death. You can also get it if you touch a contaminated surface and then touch your eyes, nose, mouth. It is very dangerous for our health. Next, I will explain the origin of COVID-19. The beginning of COVID-19. The initial outbreak of the coronavirus was found in Wuhan, China, around the end of December 2019, and spread in Indonesia since early January. According to COVID-19, it was in Indonesia because of the arrival of Japanese citizen who visited Indonesia, and it turned out that she was identified as positive COVID-19. Then the government directly treats who had interacted directly with the patient. It turned out that the patient affected by the coronavirus had interacted with two people, namely the mother and doctor. Prior to Indonesia, this Japanese foreigner had settled in Malaysia. The patient who was identified as COVID was dancing with a Japanese foreigner, and 2 days after the dance, the patient experienced a chills that did not heal. After a week later, she checked in the hospital and suggested hospitalization. 2 days later, his friends from Malaysia said that his friends who was dancing with yesterday was identified as COVID-19. Now, we continue out what are the symptoms of COVID-19. What are the symptoms of COVID-19? There are several symptoms of COVID-19, namely 1. A most common symptoms: fever, dry cough, fatigue. 2. Slightly uncommon symptoms: discomfort and pain, sore throat, daily conjunctivitis or red eyes, loss of taste and smell, rash on the skin, or discoloration of the fingers or toes. Number 3, seriously symptoms: difficulty breathing or shortness of breath, chest pain or pressure in the chest, loss of ability to speak or move. Next, how do you deal with COVID-19? There are several ways to overcome COVID-19 that we must always apply, namely. Number 1, always use masks when going out of the house. 2. Always wash your hands. 3. Always keep your distance when leaving the house. And last, always adhere to pet healthy protocol. Thanks for your attention. If there is an error pronunciation, please forgive. That is all and thank you. Stay safe.